I ask the quorum call be vitiated.
Without objection.
And how much time is remaining on the Republican side?
The time was not divided.
Okay. Well, I ask consent that we be permitted to engage in a colloquy for up to 20 minutes.
Without objection.
Thank you, Madam President. Madam President, all of us were home in August, and it was a pretty good thing we were, because the people of the United States had a lot to say to us about the health care bill. And I think President Obama was very correct when he said the health care reform bill is really a proxy for the role of federal government in our everyday lives. And I think that's what we're debating here. On the one side, we have an effort by the majority and the president to do this massive, comprehensive health care reform with 1,000-page bills and White House czars and trillions in spending and trillions in debt. That's on the one side. And we have Republicans saying, we want health care reform, but let's focus on reducing cost to each American who has a health care policy. That's 250 million of us. That's why this is so personal. That's why people are showing up at town meetings. It's not some abstract thing. And cost to our government, because we know that there are 9 trillion more in debt coming on. So I wonder, Mr. President, Madam President, I'd be glad to yield for a question.
First of all, concerning the cost, how do we really know what the cost is if we don't have legislative text? I think all of us have been around here. We've talked a lot about the 72 hours that absolutely the text should be online, so every American, not just the 100 of us who are fortunate enough to be here, but every American should have the right to know what a fundamental reform of health care in America is all about, and they should be able to read the legislation if they want to. But as importantly, I asked my friend from Tennessee, has he seen any legislative text anywhere? Is it true that the Finance Committee is moving forward with legislation that there is no legislative text? And by the way, we find out now that if, according to this bill, according to the Wall Street Journal this morning, Mr. Barthold noted in a follow-up letter that the willful failure to file, that is to take the government option, would be punishable by a $25,000 fine or jail time under section of the bill. My goodness, I wonder how many Americans know that.
Well,
how many Americans are aware of that?
The Senator,
in fact, and I have to tell my friend from Tennessee, I was unaware of it. And so, if we're unaware of it, so first, shouldn't we have legislative text that Americans should know what's being legislated in the Finance Committee? And second of all, shouldn't it be online for at least 72 hours so every American, including members of this body, would know about it?
Well, the senator from Arizona is exactly right. And he and I and the senator from Georgia are all on the Health Committee. And we spent many hours in June and July marking up the first version of the health care bill. And we finished our work about July 15th. That bill was 839 pages. It wasn't even presented to us until early in September, and we still don't know what it costs. I wonder if the senator from Georgia heard much about reading the bill and how much it costs.
The senator from Tennessee and the senator from Arizona and I sat through 67 and a half hours of markup in the Health Committee on an 839-page bill, which was not scored and had 3 titles blank, and they're still blank. So we didn't have text during that debate on 3 titles within that bill. And what they're developing in the Finance Committee today, as I understand it, is they're debating concepts. The language is somewhere that we have not yet seen. And this is too important for us to take a guess. It's too important for us to take a chance. It's most important that the Congress know precisely what it's doing.
I would ask the senator from Arizona or Georgia, maybe they know more about this than I do. Of course, they're debating concepts, but they are getting down to some specifics. I think I saw in one of the morning newspapers that Nevada somehow was miraculously taken care of in the provisions for Medicaid expenses. We've had all the governors in here saying, Democrats and Republicans saying, look, if you're going to expand Medicaid in our states, pay for it. And what happened in Nevada?
Could I say to my friend from Tennessee, first of all, it's clear that the Medicaid costs increases to the states will be incredibly large. Now, in the original version of the bill, according to media reports, the state of Nevada would have, along with every other state, a significant Medicaid expense. So somehow now the legislation has been changed, again, according to media, because, the concept has been changed because we don't have legislative language that 4 states would then have 100% of their Medicaid costs assumed by the federal government for as long as 4 or 5 years. That's what goes on with the laws and sausages business around here. But I'd like to ask again the senator from Tennessee, do you think that Americans, and I would ask, Madam President, unanimous consent that the editorial entitled Rhetorical Tax Evasion that's printed in the Wall Street Journal this morning be made part of the record. It says,
Without objection.
Chairman Max Baucus's bill includes a so-called individual mandate along with what he calls a $1,900 excise tax. If you don't buy health insurance, it would have been as much as $3,800. So American small businesses are hurting more than any other group of Americans today. The creators of jobs are now facing a $1,900 excise tax. And by the way, the president, in response to George Stephanopoulos, says there was no tax engaged here. I wonder how many Americans are aware of that, and how many Americans have had the opportunity to know exactly not only what the cost of the federal government and the respective states are, but what are the costs to the individuals who are struggling to make it in America at a time of almost unprecedented unemployment.
Well, that's a very good point. The senator from Georgia was in small business for many years before he came to the United States Senate.
I was for 22 years. I ran a small real estate company. We tried with the two distinguished senators on the floor to pass small business health reform 3 years ago, which would have made affordable, accessible health care available to those independent contractors and small business people where it's tough, but it was rejected and we couldn't get a cloture vote.
Now, may I interrupt just for a moment, because I often hear it said, well, you Republicans, you're not for too much on health care. The difference is that we have a little more humility than to try to say we're going to take on the whole health care system all at once, add trillions in debt, and fix the whole world. We're ready to go step by step, and that's one of the most important steps, which is to allow small businesses to pool their resources and offer health care to their employees. I think the estimate was that would add maybe 1 million new people who could be insured that way.
By outside estimates, not mine, of the 47 million alleged uninsured, up to 16 million would have had access to insurance because of associated health plans and small business reform. That's a third of the uninsured.
And could I say to my friend from Tennessee, brings up a good point, and an important point, that saying that Republicans have no plan. The fact is, the Republicans have no plan for the government to take over the health care system in America. That's what it is. What are we for? We are for going across state lines so that these small businesses and others and individuals, that the senator from Georgia used to be one, and get the health insurance policy of their choice. Why should they be restricted to the state they're in when perhaps there are minimum requirements in those health insurers residing in that state for coverage which they neither want nor need, and there may be in another state? Why don't we allow the small business people to pool together, to pool their assets together and negotiate with health insurers across America for the best policy they can get? Why don't we have, and we're for medical malpractice reform, medical liability reform. We know that doctors prescribe time after time to protect themselves, unneeded and unnecessary procedures and tests. We all know that. And that's in tens and if not hundreds of billions of dollars. We're for medical malpractice reform. Where is it in any bill that has been proposed by the other side? We want outcome-based treatment. We want an individual that has a certain chronic disease that to be treated on the basis of long term. We want Americans to be able who have pre-existing conditions, to have a risk pool that they can go to, that a risk pools be established so that they can go to and get health insurance, and insurers will bid on those people with so-called pre-existing conditions so that every American can have affordable and available health insurance. We are for that. We are for medical malpractice reform. We are for going across state lines to get at the policy of your choice. We are for outcome-based care. We are for taking on the drug companies that have cut an unholy deal with the administration, which will give them the obscene profits and their lobbyists that makes over $1 million. We want to be able to import drugs from Canada which are cheaper for the American people. And we want competition, as there is in Medicare Part D, for these patients that need them, that don't have health insurance. So we are for a number of things, but we are not for a government take over the healthcare system. So the next time that we read that the Republican Party does not have anything that they're for, then they're not paying attention. And there's more that we are for. It's got to do with competition, and it's got to do with availability and affordability of health care in America, not a government takeover, which we've seen that movie before in other countries.
As I listen to the senator from Arizona, and I wonder if the senator from Georgia is having the same impact, every single step that you said Republicans are for, whether it's runaway junk lawsuits, getting rid of those, whether it's going across state lines to buy insurance, whether it's allowing small businesses to pool their resources, whether it's incentivizing prevention and wellness, all of those are focused on reducing cost. And I asked the senator from Georgia, I thought this whole debate was supposed to be about reducing costs for your health care premium and cost of your government, our government. But it seems to me all we're talking about is more billions, more debt, more spending, and more taxes.
That's the two things Republicans don't want, is more debt to bankrupt our grandchildren and our children, and more taxes. And I want to make it, Robert from Loganville was on my teletown hall a week ago in Georgia. And we were talking about the pay-fors, and he said, Senator, I want to ask you a question. He said, the administration keeps talking about there being $500 million of waste, fraud, and abuse in Medicare. He said, if that's true, why haven't y'all already saved it instead of using it to save against the National Health Plan? And that's precisely right. The pay-fors that are talked about to keep us from going into debt are monies that may be there, may not be there, involve taxation, involve raising taxes on small business. Those are the things we don't want to do as Republicans.
Could I ask again the senator from Georgia, do you believe, one, that small business people in America today are ready for an additional cost laid on them to obtain health insurance for themselves and their employees? Shouldn't we make it easier and less costly rather than imposing a government mandate which may have types of health care that they neither want nor need, or pay a, quote, excise tax, as is in Chairman Baucus's bill? And the second point I would like to ask the senator about, of course, is this whole issue of what should be the government's role in health care in America today. And we freely admit, not only admit, but appreciate the fact that Medicare is a government program. But we also appreciate that the costs of Medicare have skyrocketed to the point where we now have by the estimates as I recall, a $31 trillion unfunded liability. In other words, our kids and our grandkids will not have Medicare 7 or 8 years from now unless we fix the issue of costs.
Senator is precisely right, because as of right now, Medicare goes broke in 2017. That's only 8 years from now. And in this bill, part of the pay-for is to raise the cost of Medicaid on the states to a level that would take Georgia's Medicaid payments in the year 2014 by state tax dollars to be from 12% to 20% of our state budget. That's not the way to run a railroad.
Going back to the senator from Arizona's point, though, I hear some of our friends on the other side say, well, you're running around with scare tactics, saying that there are going to be Medicare cuts. Well, I asked the senator from Arizona, did I not hear the President of the United States say he's going to take $500 billion out of Medicare for seniors? There's about 45 million seniors on Medicare. They depend on Medicare. And spend it on a new program. Is that not what I heard him say?
Well, that's why there is a rising sentiment, particularly among seniors, against this plan that the one passed through the House and passed through our Help Committee and is now being formulated. Our seniors and our citizens are a lot smarter than many times we give them credit for. And they know that you're not going to get $500 billion in, quote, savings from Medicare without there being reductions in Medicare. Now, there are hundreds of billions of dollars of savings that can be enacted in Medicare. But why don't we start tomorrow? Or why didn't we start yesterday? Or why didn't we start at least the beginning of this debate imposing those savings so that we could have a delay in the year when Medicare goes broke?
May I ask the Senator, if there are savings in Medicare, shouldn't it be spent on Medicare?
Absolutely.
That's an excellent point. But also the fact is, to root out this waste, fraud, and abuse is going to take time and effort, and it's going to require some pretty hard work on our part. But it also needs to change some of the fundamentals of the Medicare system in providing more competition in the form of prescription drugs, in the form of medical malpractice liability reform, in the form of more competition between drug companies for Medicare and Medicaid patients. And so these reforms that we are advocating have to be enacted in order to bring down the costs of Medicare, Medicaid, and overall health care costs in America. Look, it's obvious. The cost escalations that are bringing Medicare to the crisis are the same cost escalations that everybody else in America is experiencing.
And a lot of them are based in defensive medicine, which is practiced because of runaway lawsuits and verdicts. The administration's most recent comment about tort reform, which you referred to, was they want to do a study. Well, a study is not what we need. What we need is action. That's one of the biggest contributors to the rising cost of health care that we have.
A demonstration project conducted by the Secretary of Health and Human Services, who knows a lot about this, I will admit, because I understand she was head of the Trial Lawyers Association for a number of years. So I'm sure that gives significant qualifications to the person who is tasked with this. But again, life is full of anecdotes and experiences that we have. I was down in Miami at the Palmetto Hospital, and I spoke to a surgeon there. And by the way, they treat a very large number of people who have come to this country illegally. And I asked the surgeon, I said, how are you doing on making your insurance payments, your malpractice or medical liability insurance payments? He said, I don't have a problem. He said, I don't have it. He said, I don't have it because I couldn't afford it, and probably I'm not going to get sued, because if they sue me, they're only going to get everything that I've got, not what the insurance company has. So we're giving physicians and caregivers the untenable option of either paying skyrocketing malpractice insurance premiums, in some cases $200,000 a year for a neurosurgeon, or as this surgeon did and others have done, is just, I'm not going to have insurance. That's not an acceptable thing to do to physicians in America or anybody in America.
And the other consequence of that is the threat of it, and the cost of becoming a physician is driving young people to go into other professions. We're going to have a shortage of providers, not just in physicians, but in nurses or caregivers, if we have an overly regulatory system and an indefensible tort system.
Well, the senator from Arizona and Georgia have raised a number of questions that need to be answered. I mean, how much are the Medicaid, or the transfer of Medicaid to the states going to cost in state taxes? How much are the Medicare cuts going to cost people on Medicare? Are individual premiums actually going up instead of down, which is what the Congressional Budget Office said? Why is there not something for getting rid of junk lawsuits in the bill? Why don't we have small business health insurance pool? And the point that we made when we first came on here, if we're taking on 17 or 18% of the whole economy in another one of these 1,000-page plus bills, why then did the Democratic senators vote down the amendment to say that the bill needs to be online for 72 hours so we and the American people can read it? Shouldn't we read the bill we're voting on, and shouldn't we know how much it costs before we start voting on it?
The senator is exactly right. And again, wouldn't it be nice for our constituents, by the way, many of them who come to the town hall meetings with a sign that says, "Have you read the bill?" Let them read the bill too. Wouldn't it be nice if every American citizen that wanted to could go online and read the legislation, give us their ideas and thoughts as to how we could make it better? And could I mention, I hate to won't come back to this issue of medical liability again, but a PricewaterhouseCoopers study says that defensive medicine could cost us as much as $200 billion annually. So if we're really interested in savings, why don't we go right at that? Do we need a demonstration project someplace around America? I don't. And could I mention one other thing, and I'd be interested in my colleagues' views on. This proposal also levies new taxes on medical devices. Why in the world would we want to do that? Medical devices and the best technology in the world is developed here in America, but they're very expensive as they are. Why would we want to levy new taxes on medical devices when we know very well that if the insurance company then is paying for them, the insurance company passes on those increased costs to the insured, thereby increasing the cost of health insurance in America? Why would we want to do that?
And raising the cost to the consumer, because a lot of those types of things that are being taxed are things that are purchased discretionarily, aren't covered by insurance, it's paid for out of the pocket of the consumer. When you tax the medical device, you're just raising the cost of that medical device to the consumer.
So what we're doing here is what the other side is trying to do here is expand government, expand coverage, and yet at the same time reduce costs. You can't square the circle. And that's why they keep bumping into, every time there's a new proposal, and to make things more expansive and more available, they run into escalations in costs and how are we going to pay for it. And I believe that our constituents, again, have figured it out. Re-estimate of $7 to $9 trillion deficit over 10 years. A $700 and some billion stimulus package that may have stimulated Wall Street, but frankly, in my view, from being home a lot, has not stimulated Main Street and has not had an effect on unemployment in America, to say the least. Neighboring state of California now has 12.2% unemployment, and so they can't get to where they want to go without increasing that deficit and debt burden that we're laying on future generations of Americans. I wish they would sit down with us. I wish we could sit down together, start from the beginning, knowing what we know. We've all been well educated by this process, knowing what we know now, knowing what we can do to reduce health care costs in America and make it affordable and available. Unfortunately, we watch the machinations that are going on in the Finance Committee. That hasn't happened yet.
Well, I completely concur with the senator from Arizona and senator from Tennessee, and there is common ground, but you've got to be willing to find it, and so far that hasn't been the case. When we get to that point, we can solve a lot of the American people's problems, but just ramming through something we can't read, we can't quantify, and we can't score is not the right way to go about it.
If there were one point I think we'd like to make, it would be this. This is such an ambitious program. The stakes are so high. This is no abstract debate. The reason people are turning up at town meetings is about your health care insurance, and it's also about whether your government's going to go broke in the next few years, dumping a lot of burdens on our children and grandchildren. So what we're saying is we need to read the bill, and we need to know how much it costs before we start voting on it. We need to read the bill. It needs to be online for 72 hours. That's a modest request, it seems to me. That's a short period of time. And then we need to know how much it costs. Does it raise our premiums or does it lower them? Does it cut your Medicare or does it not cut your Medicare? Does it increase the national debt or does it not increase the national debt? We need to know the answer to those questions, and it would be the height of irresponsibility for us to begin debating a bill that affects 17% of the economy at a time when our debt is going up so rapidly without having, one, read the bill, and two, knowing exactly what the nonpartisan Congressional Budget Office tells us every provision costs.
Could I tell my friend, if the American people were able to know the details of this legislation, I think they would be surprised to know that the new taxes, the medical devices, the prescription drugs, and other tax increases, they begin in the year 2010, 3 years before the provisions in the bill for, quote, reform are implemented. So for the next 3 years, the cost of health care and health insurance goes up due to the new taxes and fees, but the so-called reforms are not implemented. Now, why did they do that? So that their actual cost, as we've costed out on a 10-year period, is disguised by beginning the taxes and not implementing the reforms, which then the Congressional Budget Office then can give a cost estimate which is less than, frankly, what it actually is if you put the reforms in at the same time as the tax increases. That's a little complicated, but I think Americans really need to know that.
And my only comment in closing is simply this: the senator is exactly right. And once this horse is out of the barn, you can never put him back in. We've got to get it right to begin with. We need to go back to the drawing board, have a bill we can read and a bill we can afford.
I want to thank the senator from Arizona, the senator from Georgia. I mean, they've said what we believe. We need to start over, get it right. Above all, it seems such a basic thing to say that it's almost embarrassing to say it on the Senate floor. We need to make sure we read the bill before we begin to vote on it, and we need to make sure that we know what it costs before we vote on it. Those two things are minimum requirements. And from the Republican side, we want to reduce health care costs. And rather than try a comprehensive health care reform of the whole system, we would like to work step by step in the direction of reducing costs in order to re-earn the trust of the American people. And Senator McCain and Senator Isaacson have outlined a series of steps ranging from limiting junk lawsuits against doctors to allowing small businesses to pool their resources, all of which would help to reduce costs. I thank the senators and I yield the floor. I notice the absence of a quorum.
Clerk will call the roll.
Mr. Aconcagua.